I want to introduce on the phone Russ Read. He's the co-founder of the Kentucky Harm Reduction Foundation. Amongst other things, they offer free clinics teaching individuals how to use a narcotics reversal agent correctly. So, Russ, number one, boots on the ground there in Kentucky. I know Kentucky's one of the top 5 states for overdose deaths. How bad has it gotten?
Well, it's really gotten quite bad, and obviously it's a national epidemic, and there's Louisville just happens to be in the bullseye right now. Those drug dealers want to have the very best product they can have out on the streets. And when somebody goes to that dealer and buys a bag of heroin, they don't really get a bag of heroin. They don't know what they're going to get. They don't put the ingredients on the bag. And I'll disagree with you on one thing. The dealers don't care if their people die. They care about getting that money because there's plenty of other people out there that will seek out that dealer because he had the best product out there. Somebody overdosed and died. That person, because they're suffering from a disease of addiction, they will go to that dealer and say, well, I can probably handle it. And unfortunately, they can't.
Well, my question is, and you know, providing these at-home naloxone kits is interesting. Is the effort to combat the dealers just failing that much that's not the best way to treat this problem?
Well, no, it is not the best way to treat this problem. What we're doing is trying to address those people who have this disease of addiction and enabling them to live another day. And if we can keep these people from dying, if we can have that 10 to 15 minutes that we need with them to explain what naloxone is and how to give it, we've got some serious eye-to-eye contact with people in addiction, and then we can tell them there is hope. There is a way that you can recover, and there is a way to treatment, and here's the way it is. But unfortunately, if they don't have the naloxone kit, and nobody's going to be saved, and they're going to die, and we can't help them in the treatment.
I'm curious. In the news has been much ado about the increased cost of the naloxone that can be used out on the streets. How is anyone even able to afford this?
Well, that's one of our primary goals is to make sure people that need naloxone can get it for free. I was asked by your producer earlier, what's the percentage of people that actually pay for a kit and the percentage that we give away, and it's about 90-10. 10% can pay, but 90% can't. So we get our funding through the Office of Drug Control Policy in Kentucky, and we also get some very generous donations to buy these kits.
Can you give us some price points? What are they paying for their heroin, and what would the kit cost?
You know, heroin you can get a point of heroin for $10 or $20. Okay,
Wow.
And then. But the cost of the naloxone, just the medication itself, is $75 a box. And in each one of those boxes, you get 2 doses. And let's not kid anybody. With the potency of the drugs that are out on the street today, 1 dose of naloxone is not going to bring somebody back. You're going to have to at least have 2 doses, and in some cases, 3 and 4.
And I will say this reversal agent can be incredibly effective, literally taking someone who is pretty much dead and reversing that, giving them a chance at life. We've got to figure out this problem.
Yes.
We're blessed that we have a reversal agent. Number one, we got to figure out how to make it more affordable. It's absurd that the cost of that has gotten so high while the price of heroin and other opiates seemingly on the street, it gets easier and easier to obtain it. I want to applaud you, Russ, for your work, and may we hopefully make some progress in this terrible epidemic, and we won't be reading these headlines as much.